Imagine living thousands of years ago, long before modern medicine, anesthesia, or even a basic understanding of germs. Now imagine undergoing brain surgery in that era, without the sterile conditions of a hospital, without painkillers, and with nothing but primitive tools. It sounds like a nightmare, yet our ancestors performed complex brain surgeries, some with astonishing success. How did they do it? And what drove them to attempt such a daring and dangerous procedure? This article explores a remarkable history of the first brain surgeries, the techniques ancient doctors used, and real-life cases of patients who survived these incredible procedures. The dawn of brain surgery. Trepanation, one of the earliest forms of brain surgery, known as trepanation, involved drilling or cutting a hole into the skull. Archaeological evidence suggests that trepanation was practiced as far back as 7000 BCE, with skulls found in regions such as Peru, France, and Africa showing clear signs of surgical openings. Some of these skulls display evidence of healing, indicating that patients survived the operation. Why would ancient doctors attempt such a risky procedure? There are several theories. Some researchers believe trepanation was performed to relieve pressure from head injuries, such as those caused by battles or accidents. Others suggest it had spiritual significance. People may have believed that cutting into the skull could release evil spirits responsible for mental illness or epilepsy. Regardless of the reason, early surgeons demonstrated remarkable skill, using sharp stones, obsidian knives, and even early metal tools to perform the procedure. The real-life evidence. Ancient Peru's surgical pioneers. One of the most compelling examples of ancient brain surgery comes from the Inca civilization in Peru. Archaeologists have discovered hundreds of trepan skulls in the Andean region, with survival rates as high as 80%. Compared to later historical periods like the American Civil War, where surgical survival rates were often much lower, this is an astonishing achievement. A well-documented case involves a skull found in Cusco, Peru, dating back to 400 BC. The skull has a perfectly round hole, carefully carved with precision, and the bone surrounding the opening shows signs of regrowth, proof that the patient survived the operation. The Incas may have used natural anesthetics, such as coca leaves or fermented chicha beer, to reduce pain. They also developed antiseptic methods, possibly using medicinal plants to prevent infection. Ancient Egyptian neurosurgery, medical papyrus, and mummified evidence. The ancient Egyptians were another civilization that ventured into brain surgery. The Edwin Smith Papyrus, a medical text dating back to 1600 BCE, details surgical techniques and describes head injuries, including fractures and wounds. It even mentions the use of bandages, honey, a natural antiseptic, and sutures to close wounds. Mummified remains also offer clues. A famous case involves a mummy discovered with a carefully drilled hole in its skull, leading scientists to believe that Egyptians performed trepanation to treat conditions like head trauma or epilepsy. Their understanding of the brain may have been rudimentary, but they were skilled in wound care, often using honey and herbs to prevent infections. Ancient Greece and Rome. The birth of surgical theory. By the time of Hippocrates, 460 to 370 BCE, and Galen, 129 to 216 CE, brain surgery had advanced in both technique and theory. Hippocrates, considered the father of modern medicine, documented brain injuries in his texts and recommended trepanation for head trauma. He advised against cutting too deeply, recognizing the risk of damaging brain tissue. Galen, a Roman physician, furthered this knowledge by studying the nervous system through dissections of animals. He understood that the brain controlled movement and sensation, which helped refine surgical techniques. Roman surgeons used metal scalpels, bone saws, and forceps, indicating a significant leap in medical knowledge. However, without anesthesia, these procedures remained excruciatingly painful. Medieval and Renaissance brain surgery. The path to modern medicine. During the medieval period, brain surgery largely regressed due to religious restrictions and limited medical knowledge. However, by the Renaissance, the study of human anatomy was revived. Pioneers like Andreas Vesalius, 1514 to 1564, published detailed anatomical drawings, and physicians began experimenting with more advanced surgical techniques. One astonishing case from the Renaissance period is Ambrose Pare, 1510 to 1590, a French surgeon who treated battlefield injuries. Pare developed innovative methods for treating skull fractures, including using metal plates to cover bone defects. His work laid the foundation for modern neurosurgery, the legacy of ancient brain surgery. The courage and ingenuity of ancient surgeons paved the way for modern neurosurgery. Today, brain surgery is performed with robotic precision, guided by MRI scans and laser technology. But the fundamental concept remains the same: opening the skull to relieve pressure, remove tumors, or treat injuries. What's truly remarkable is that thousands of years ago, humans dared to operate on the brain using only their instincts, experience, and basic tools. Their successes, preserved in the bones of our ancestors, prove that even in the face of extreme medical challenges, human determination and innovation have always found a way forward. Conclusion: the story of the first brain surgeries is one of courage, curiosity, and resilience. Ancient doctors, despite their limited tools and understanding, performed life-saving procedures with surprising success. Their work laid the groundwork for the sophisticated neurosurgical techniques we rely on today. Whether driven by necessity, superstition, or sheer determination, these early medical pioneers remind us of the incredible human spirit, the drive to heal, to learn, and to push the boundaries of what's possible.